Welcome back, a past guest to this program, Demian Brady. He is the VP of Research at the National Taxpayers Union, and he discusses what the deal is here and maybe explains a little bit as to what's going on here. Hey, Demian, it's Paul here in Bridgeport once again. How are you, sir?
I'm great, Paul. Thanks for having me on. How are you?
I'm good, Demian, but I'm trying to figure this out like a lot of Americans here, what to do and how to view this government shutdown here. One side says the other side is lying. That side says, no, you're lying. It has to do with health care and subsidies connected to Obamacare. So lay this out for us, Demian, and for my listeners here. What is causing this whole thing?
Yeah, it's ridiculous. This is a process that only happens here in Congress.
Yeah.
There's at the heart of it, there's a law saying that no money can be spent unless Congress approves it. So, so they have to pass appropriations every year, and that process has really broken down. So now we're in the midst of our 21st government shutdown due to a lapse in funding by the failure of Congress to come to an agreement. It's completely ridiculous. There is an easy solution that we can talk about later,
Sure.
But in the meantime, the Republicans in the House have passed what's called a continuing resolution that would just continue funding, I think, until around Thanksgiving, sometime in November.
Yeah.
And that would give lawmakers time to approve a total spending package for fiscal year 2026, which started on October 1st. So, we're past the deadline for that. That's why we're in the shutdown. Democrats in the Senate are refusing to approve that. They think this is a great opportunity to hold the government up, shut down taxpayer-funded services and operations, and poorly treat federal employees who are either furloughed or forced to work but can't get paid to do essential work. And they want to continue some Obamacare subsidies that were increased temporarily by President Biden first through his American Rescue Plan Act. And it was provided on a short-term basis. The point at the time they argued was that, we're in this pandemic, and we really should try to do things to help people get health insurance.
Yeah.
So we'll plus it up, make it more generous, and expand it to more people well above the poverty line. That was extended again in the so-called Inflation Reduction Act, and they're supposed to expire at the end of this year, and then it would go back to what the Democrats had passed in the Obamacare law. So they're holding everything up because they think those ought to be extended, and they have some other proposals as well. But so it would be about $40 billion a year to make those tax subsidies permanent that they want to put in place. And then they have other demands as well, which could run up to $90 to $100 billion a year in new spending on taxpayers' tab.
So, Demian, so people understand, these subsidies, these Obamacare subsidies and the increases that were okay during the Biden years, like they could have signed a continuing resolution, what I guess they call a clean CR, and then had further debate on that. Am I reading that right? There's no reason that they have to do those Obamacare subsidies now or not. Do they have to act on those or not?
Well, first of all, the Democrats had the trifecta under President Biden. They could have made them permanent, but they're super expensive, so then they just passed them on a short-term basis, and now, they're supposed to expire and go back to what they were. From the Democrats' point, they're arguing that the Republicans probably won't negotiate with them and give them the whole thing that they want, and making these tax subsidies permanent. And I call them a tax subsidy because, it's a tax credit, but most of its effect goes to people who well above and beyond any income tax obligation that they owe. So they end up getting a net check from the federal government to buy health insurance in the Obamacare exchanges in each state. So it's a huge, huge subsidy that other taxpayers are being forced to pay the bill for if they do make it permanent.
Now, you guys at the National Taxpayers Union, and Demian Brady is the guest, VP for Research, you talk about rogue health insurance brokers here, and the role of these brokers. I have not heard that mentioned once in all the media coverage of this, Demian. Explain that a bit. Go into that.
Yeah, there are some issues because it's a very complicated tax credit subsidy. And the way it works is you tell the IRS how much money you think you're going to make that year, and you get an advance payment from the IRS for that amount. So, it's an incentive for a lot of people to go, or for certain companies and bad actors to go out and tell people, hey, you need to sign up for this. And then when those filers come around to tax day next April, they're supposed to reconcile what they got from their IRS versus what their actual income was. So there's a lot of improper payments through this program because of the way that it's made advanceable. So that's another big red flag about this. First of all, it's just supposed to be a temporary increase in the program, and then there's all these complicated rules about getting it, and then trying to make sure that taxpayers aren't subject to overpayments under the way that it has been expanded. It's not fair to taxpayers.
And you folks, Demian, finally here, you point out, Demian Brady, an ironic twist here. I guess what? You folks were supposed to hold a workshop here to help some members of Congress do basic budgeting work here. What was that about?
Yeah, that's right. We have we've been planning this an event on the Hill, inviting Hill staffers to talk about paths towards fiscal discipline and getting congressional fiscal budget back in order. But because of the shutdown, that had to be postponed. But it's still something that needs to happen. And I mentioned a possible reform bill earlier. Senator Lankford in the Senate and Jody Arrington in the House have this bill called the Prevent Government Shutdowns Act. So in the event that Congress can't agree on funding levels for the next fiscal year, this law provides for continuing rolling short-term spending bills at the previous level, and it requires members of Congress to come to D.C. They can't spend any money to leave town, and they make them hammer it out and come to a deal. So that way, and it's ridiculous that, as I mentioned earlier, the way federal workers get treated through this whole process.
Yeah,
if this lasts a whole month, that's. A lot of people have rent, they have to buy food, and it's just they're being held hostage to plans to increase deficit spending, and it's completely inappropriate.
Yeah, as I like to say, Damian, I said this earlier in the show and over the past few days. Listen, you're all adults. Get in a room, order a lot of pizza, and figure it out. Right? Come on, this is. But we know why, Damian, because they can raise money off it. Right? I mean, look at all the stuff going on right now. This is playing into, sadly, the midterms for next year already.
Yeah, I think it also has to do a lot with gerrymandering, the way states write their draft and draw their congressional districts. Some districts are just extremely partisan, so members are just speaking to their particular base, or they'll be able to raise money from groups in other areas, and it generates polarized politics. We really ought to be finding solutions here to prevent shutdowns like this from happening again, and set the government on a path towards fiscal discipline. We have a $37 trillion federal debt. We should be looking for ways to rein in out of control spending, not holding federal employees basically hostage to more deficit spending on top of what we already have.
Exactly. Much thanks. He's been on with us before. Demian Brady. He is the VP of Research at the National Taxpayers Union. And folks, if you want to check them out, very simple website, ntu.org, ntu.org. Demian, thanks. We appreciate the time as always, and we'll chat down the road. Thank you, sir.
Thank you. Great. Have a great day.
Thanks, Demian. Appreciate that.